Hello again, everybody. And today in 3 to 5, I'm going to talk about some of the myths that actually generate and perpetuate the global health crisis. Now, there are 8 of them, and I'd like to talk about 4 of them today because of time constraints, and I'll cover the other 4 in the next session. Okay, so now according to the Oxford Dictionary, a myth is actually a widely held but false belief or a misrepresentation of the truth. And on this point, I must emphasize that the purpose of this video is purely to share the relevant information related to these myths and facts as proven by research, and in some cases, my own experiences and observations as a medical doctor. Of course, if you don't agree with this information and you would like to discuss this with me, please feel free to contact me in this regard. I'd be more than happy to learn about your position and discuss, this matter further. Okay, so onto the myths and facts. And the first myth is that doctors know best how to get their patients healthy and well. Now, this is, of course, not true at all. Unfortunately, the training of conventional doctors largely involves the management of illnesses and diseases of their patients rather than, the optimization of their health and wellness. So despite the good intentions of conventionally trained doctors regarding the health and wellness of their patients, they're really not equipped to bring about any lasting changes in the lives of their patients in this regard. So actually the sad fact is that conventional doctors are not involved in healthcare at all, but as I've said, in illness and disease management. In fact, the word healthcare or the term healthcare is an unfortunate misnomer. Now, the second myth is that illness is actually due to genetic factors and there's nothing patients can do about this. No, the sad fact is that, or not the sad fact, but the good fact is that only a small percentage of illnesses and diseases are due to genetics. In fact, factors which are preventable, such as chronic, psychological stress and its consequences, poor nutrition and bad lifestyles and environmental factors, are actually are responsible for most illness and disease. For example, if you take breast cancer in Chinese women living in China, the risk there is 1 in 5,000. But for Chinese women living in the USA, the risk factor there is 1 in 8. So it's just the environment that changed, which caused an increase in risk of getting breast cancer for Chinese women moving across from China to the USA. So environmental factors actually play a big role in illness and disease causation, and not genes. And it's actually been shown that, even if a person has inherited genes that increases his or her risk of disease, the person can actually minimize, even eliminate this risk with the right diet, healthy lifestyle, living a life free of ongoing stress, and of course, dealing effectively with negative environmental factors. So now the third myth is that increasing the number of doctors in the country will solve its healthcare problems. Now, again, this has been shown not to be true. In fact, research has shown that there's actually no correlation between the number of doctors and the life expectancy of people living in the country in which the research was done. So if you look at the United States, there's 300 doctors per 100,000 people, and the average life expectancy there is 70 years. Whereas in England, it just has slightly over half, slightly more than half the number of doctors in the USA, but the average life expectancy is slightly higher than that in the USA. So the fourth myth is that spending more money on healthcare will solve the healthcare crisis. And again, this is not true at all. If you look at this graph again, it shows you that, for example, in Greece, they spend $964 per person per year, and that was in the year 2000, and the average life expectancy is 72.5 years, whereas in the United States, it's way more than that that's spent on healthcare per person per year, and the life expectancy is less than that in Greece. So again, proven that that is a myth, that if you spend more money on healthcare, that people are going to live longer and healthier lives. Okay, so that's it for the first 4 myths, and we'll cover the next 4 in the next session. Thanks.